Sean is saying that he was diagnosed with follicular lymphoma in 2022 and am in active treatment. What advice do you have for someone transitioning from patient to survivor? I am eager and fearful.
Well, another good question. And I think, one thing I want to recognize is that somebody with cancer is defined as a survivor from the time they're diagnosed moving forward. So you're already a survivor. But I do think, and I tell patients this even when we're talking about starting treatment, I do think that being aware of kind of where patients are at mentally is important, right? Because when a patient goes through treatment, they're very focused on next steps. And next steps when you're going through treatment are, when's my next treatment going to happen? When's my next scan going to happen? When you get to that point when you're done with treatment, you no longer have those small milestones that you're reaching, the next treatment, the next scan. You now are like, oh my gosh, I had this treatment and now, how long is it going to last? What's going to happen to me? What else can happen to me? And there can be a lot of fear and anxiety. I would first tell you that's totally normal. That is a normal feelings to have at this point. So I think one, recognizing that you have them is important. I think considering things like we've talked about, is there survivorship clinic? Is there psychosocial oncology? Is there something that might help in talking those things out? I think setting up milestones, what is the next thing? I'm going to have a 3-month appointment. I'm going to have labs. These are the things I need to be thinking about, but if I'm not noticing these also, what things can I do to return to my, the things I like to do. I think also I would go back to saying, I think this is where just thinking about getting good sleep, getting exercise, eating a healthy balanced diet, and then socializing and making sure that you're involving friends and family.
Okay, thank you. And Sean, you're already a survivor. Dr. Maddocks said so.